I'm Mark Bonahati, a Northwesterner by birth. Grew up in Oregon and lived in California and here in Washington for many years, and immunologist by training. And it was very clear to me from my impediment in walking, pretty constant pain. If I was sitting, I was fine. Standing or walking became challenges, right? I had what's called foot flop, right? Where you start to lose the fine control, and when walking, you hear the foot slap down and stuff, and I just got more pain and then numbness in the legs, and it was just harder to get them to do what I want. I figure as you get older, one thing you'd love to be able to do is be able to walk, right, without pain. And so for me, that's kind of the major piece there. Is I know, if this had continued another 2-3 years, I'm pretty sure I would have had to use a cane or go to a wheelchair. And so didn't want to do that, at least not yet. I have to be patient. It's not like the hip replacement. It's a little more profound intervention, and I just have to respect the healing process. So. I love data. I love, interpreting data. So I spent many years working in the regenerative medicine space, stem cells, immunology, and a lot of it's been in bone or cartilage regeneration. So I'm very familiar with what's on the horizon and what's actually in place and has a good track record. And so as I kind of approached knowing that I'd have to do this back procedure, I started doing my research, and I was very fortunate that my cousin's daughter's husband is an orthopedic spine surgeon. He just finished his residency, so he's now practicing. And I had the good fortune of asking him about if he had any recommendations. He recommended Dr. Hart for several reasons. He just said he's great. He's got great technique. He's a great teacher, really knows his stuff. And to me, that word of mouth from someone I trust was extremely valuable. He recognized right away, we need to intercede now. Because if you don't, it's going to really get progressively worse and irreversible. This was my philosophy too, and I was looking for someone to kind of confirm this, and it was done in a way that was, I think, we were just very mutually aligned on where I was and how long I could put this off, and when we really need to pull the trigger on it. I think him and his staff are particularly good at trying to educate patients. They provide a lot of resources, information, background reading you do to prep for it, dietary things, and I found that really reassuring. My hindsight's 100% correct. I put it off as long as I felt I could because, it's a big deal. But now that I've done it, I'm so grateful when I'm on the other side of having it done, and now everything is just incremental improvement back to levels that are acceptable to me. And the one thing that I think was really important message I got from both Dr. Hart and my cousin's daughter's husband was that, you'll see progress not necessarily in days, but in weeks.